Guys, take a look here. You do root canals like this, and then you don't see the patient, and you think that your root canal was successful because you don't see the patient doesn't come to you. So this root canal was done a few years ago by this patient's dentist. And take a look here. You only get lucky once. Look how short the fills are here. No periapical lucency. And look at this tooth though. Large periapical lucency, and patient has symptoms. This one here, this dentist missed the canal here on the mesial, and you can see that large periapical lucency here. But look at this one here. Dr. Lin, may you rest in peace, brother. So this patient is coming back, so unfortunately we have to go through her crown. Crown's not very good, so she's gonna need to get a new crown anyways. But we need to redo this root canal. So, moral of the story, don't do root canals like this. Alright, so check this case out. This patient came to me in 2021. Take a look here. 2021. Complaining of pain associated with tooth number 30. He had traumatized the tooth. He was hit in the face with a metal bar prior to that, a couple of years prior to that. So I couldn't even touch the tooth. It was so sensitive to even light, very light digital touch. Looks like perhaps maybe inflammatory resorption right there. All right. So tooth, according to the patient, hurt to everything. So I went over options with him. I went over the possibility of inflammatory resorption there, and went over the root canal versus extraction and all that stuff. Spent good amount of time with him. So he left. Never saw him again until today. He comes in today, and take a look. He went somewhere else and got the root canal done. And that's okay. I don't take it personally. He got the root canal done somewhere else, but now the tooth hurts. Patient said he went. I didn't ask him where he went. I just, I said, you had the root canal done. And he said, yeah, my previous dentist did the root canal. He had 2 offices, and he closed one office that was near my house, and the other office very far away from me. I said, how come you're not going back to him? He said that his office is too far away from my house, so I don't want to go. He said after the root canal, tooth has never felt the same. Aches, bothers him. Went back to his dentist a couple of times when he still had the office near a patient's house, and the dentist had done some occlusal adjustments, but patient said that the tooth has never felt right after the root canal. And I was so tempted to tell him, well, it's because you didn't come here. You went somewhere else. Anyway, so take a look at the tooth here. What do you see? What do you see? Tell me what you think the issue is. Percussion, very tender. Palpation, slightly tender. Probings, 2 to 3 millimeters all around. The probings were normal, within normal limits. Normal mobility. Take a look here. I think there is another distal canal that this dentist missed. Look at the distance from here to the gutta-percha. Look at the distance from the gutta-percha to the outer surface of the distal. It's not the same. This side is larger. You see that, right? I think there's another canal in the distal that the dentist missed. And if you look here, you can see that radiolucency right there. And that is sometimes an indication of a missed canal. So I went over everything with the patient. Told him we can redo the root canal, no promise or guarantees you can pull it. And he said he's gonna think about it, and he left. Check out this case now. This root canal was done 2 years ago by the patient's previous dentist. It's a good-looking root canal, like some of you may think. Good-looking root canal, I don't know what that means. Good-looking root canal means pretty white lines on an x-ray, right? Is that what you mean? Good-looking root canal. And this dentist also even found the MB2, as you can see here. So why did this root canal fail? Patient was in a lot of pain. Very tender to percussion and palpation. Probings 2 to 3 millimeters all around. But look at right here. Huge periapical lucency. Huge. Right? Good looking root canal. Why did it fail? Some of you always ask. Good looking root canal. Okay. Good looking root canal on an x-ray. Do you see microorganisms on this x-ray? So just because a root canal looks good on an x-ray doesn't mean it was done properly. So what if this dentist who did the root canal didn't use a rubber dam, didn't follow the fundamentals, adhere to the fundamentals of endodontics? Or perhaps maybe he did, and when he was building the tooth up and crowning it, saliva and bacteria got in. I don't know, but somehow saliva and bacteria got in. Either sometime during the root canal or sometime after the root canal. So huge periapical lucency. So this patient's coming back, so we redo the root canal for her.